Hepatitis C is a blood-borne pathogen. It's a virus that is transmitted from person to person by way of blood.
You can't really know unless you go through it. There's so many tragedies in life where people say they understand. They can't possibly know. And everybody in my family thought I wasn't going to make it. My husband, Winona, Ashley, my best friends, my pastor.
The reason hepatitis C is a problem is because it can cause inflammation and scarring and lead to the development of cirrhosis and liver cancer and liver failure.
I looked at a slide of my liver biopsy under the electron microscope, and it actually looked to me like, with my informed eyes, that I was going to die.
Patients with hepatitis C very often just feel bad. They didn't feel right. Many of them complained of not being able to concentrate or being fatigued.
But my guess in my case was that I was working at a hospital in ICU, so I probably got a needle stick. Then we get signed to RCA Records. We had this amazing music career for 8 years, and I started feeling crummy. I felt malaise, I felt like a low-grade temperature, a little bit of a headache. I knew something was really wrong.
So I've had the benefit during my career to watch the evolution of hepatitis C through its whole life cycle.
In the early years, a lot of the research was about trying to understand the disease. A diagnostic test had to be developed so you knew who had hepatitis C and who didn't, what kind of diseases was it associated with. It causes liver disease, but it also causes some other problems. So that was part of the research that was going on. We have a network of liver researchers here at St. Louis University from several departments that have worked on hepatitis C for the last 20 plus years.
In 1989, hepatitis C was discovered and it was named hepatitis C. It was identified as a distinct virus. The first treatments that were used in the early 90s were use of an injectable medicine called interferon, and patients would take injections 3 times a week for 6 months, and maybe 2% of them or 10% of them would have a favorable response and get rid of the virus. A very small percentage of patients would benefit by that, and there were a lot of side effects from the interferon.
I'm a registered nurse. In fact, I was going to become an MD from Winona, wanted to move to Nashville to sing. So I already knew a little bit about hepatic viruses. Obviously, HEPA is the word for liver. Then ITIS on the end of a word just means inflammation of, infection of. So appendicitis, bronchitis. Hepatic refers to a big inflammation in the liver, hepatitis. I felt terrible, and once I was actually diagnosed with it and told I had 3 years to live, I was furious. But I was going to fight. I had to retire, which absolutely broke my heart and changed my life forever. I became very depressed, started having anxiety disorder. But I was here at the farm, and I fought. I met with experts, studied all of their placebo-based double-blind clinical trials, and eventually I met Dr. Bruce Bacon.
I've been blessed to have a lot of really wonderful patients to take care of over the years, and one that really stands out was Naomi Judd.
He was fabulous, fabulous, and I knew it the minute I met him. We were doing PSAs, public service announcements together, and I went, wow, I just asked you a question. You said you don't know the answer, but you'll find out. I've never heard a doctor say they didn't know. I just fell for him. He was Dr. Right.
I'll never forget, on a Friday afternoon, we'd had a conference at noontime, and I got a page, and my secretary, he said, we got a call from Naomi Judd.
We were put together. We had never met each other, heard about each other. He had no idea who I was, which was fun, because he saw me as a person.
And she kind of told her story. She had hepatitis C. She had been a nurse before she was a singer. She'd gotten needle sticks, and she felt bad from the hepatitis C. She was very fatigued, and there was a lot in the media at that time that she and Winona had stopped their tour at the time. And
Dr. Bruce he laughed. He had this little boy grin. He laughed at my corny jokes. We just felt like we'd known each other for a long time. He has that way about him, and that's what you want in a doctor. You want somebody that gets it.
And she was cured. So that happened in a small percentage of people back then. This was in the mid-90s, and she was one of those people.
It was better than winning 6 Grammys. It meant my life. I was in the Michelangelo Hotel, room 307 in New York City in 1985. It was winter. Ashley was with me. Dr. Bacon called, and I held the phone out like this because he was getting ready. He said, "I've got some very special, important news to tell you." And I was waiting for my count. I held it like this so Ashley could hear. And then when he said, "You're cured," I remember hearing Ashley gasp. Then I started. He had to repeat it several times. And I just began sobbing, and we talked for a few more minutes about how it all came to be and what he thought my prognosis was. Then Ashley and I walked down to a cathedral and got down on our knees on the cold marble floor and just thanked God for saving me. And she was crying, I was crying. We hadn't brought any Kleenex. We were using the hem of our skirts. Funny the things you remember.
I often say to patients, I point out to them how powerful the word cure is. You can say, "I'm better," or "I'm feeling okay," but cure is really powerful. I mean, it's in our lexicon, in our vocabulary, cure is a really important word, and they get it.
Attribute him with saving my life.